Every day, millions of Americans suffer from a vein disease commonly known as varicose veins. Over 1 million people each year seek treatment for the painful and debilitating consequences of this disease. Varicose vein disease is noted by enlarged and twisted veins raised above the surface of the skin. Varicose veins often result in symptoms ranging from slight tingling to painful aching. This video will describe the causes of varicose veins and non-surgical treatment known as endovenous laser therapy. Varicose veins are one of the most common vascular diseases, affecting approximately 25% of women and 15% of men in the U.S. Historically, a surgical procedure known as vein stripping was used for treating varicose veins. Vein stripping is performed in a hospital operating room using general anesthesia and is associated with a painful and lengthy recovery period. Now, many physicians and patients are replacing surgical vein stripping with a non-surgical alternative called endovenous laser therapy. Endovenous laser therapy is a proven treatment alternative for the vast majority of varicose vein patients. The laser therapy requires only a minimal incision, no hospitalization, and patients are often able to walk and return to normal activities the same day. Donna Ring discusses the benefits of the laser therapy versus vein stripping. She will give personal testimony from her past experience with both therapies.
Previous experience with surgical stripping and ligation is that patients come to the clinic postoperatively with a lot more pain, discomfort. Their recovery phase takes longer. They have more downtime from work. They're usually at home 4 weeks. Not only that, but they may have relief from their pain, their symptoms from their varicose veins for a short period of time, but frequently that's what was treated was just the varicose veins and not the reflux from the great saphenous vein. And so 2 to 3 years reoccurrence typically is back with the pain and symptoms.
So what causes varicose veins? In healthy veins, blood travels in one direction only, up the leg to the heart. To prevent backward flow of blood down the leg, a healthy vein contains valves which open and close with the contraction of the leg muscles. When these valves fail to completely close, blood can begin to pool in the vein. This, in turn, causes the vein to expand and creates the visible bulging known as varicose vein. If left untreated, varicose veins can lead to a restless feeling in the leg, difficulty walking, and even open sores. Heredity is a contributing factor in 70% of all varicose veins. Other factors causing varicose veins include pregnancy, age, obesity, and occupations that require long periods of sitting or standing. Dan discusses the factors that caused him to seek treatment, including itching and the appearance of his legs.
My legs itched quite a bit. They weren't at the point yet of being painful, but they itched quite a bit. And the other thing that probably was most noticeable for me is that it was becoming noticeable, and it was something I didn't enjoy wearing shorts as much, or it was something my family was starting to notice, particularly my daughter. You know, she didn't think my legs looked as nice.
Treating varicose veins by endovenous laser therapy is a quick and effective process. The first step is a consultation with your physician and ultrasound examination. Based on the exam, your physician may determine that endovenous laser therapy is the best treatment option for you. Your physician will then answer any questions you have about the procedure and discuss the costs and insurance coverage. On the day of your procedure, your physician and assistant will first map out the treatment area of your varicose vein with a marker. While the symptoms of your varicose veins may be apparent in your lower leg, the cause may be higher in your thigh where the endovenous laser procedure will be performed. After mapping, you will lie on the procedure table and local anesthesia will be used to numb the leg to be treated. A small puncture will be made, usually above the knee, with the use of a small needle. A wire, sheath, and laser fiber will then be inserted into the vein to direct the laser energy to the treatment area. The laser console is then activated, delivering laser energy through the fiber to the vein. The laser fiber and introducer sheath are slowly withdrawn as the laser energy is delivered, causing the vein to close. The actual laser treatment usually takes less than 5 minutes, and most patients feel little or no sensation in the treated leg during the therapy.
The patients should feel nothing when the laser fiber is being pulled back because the vein is completely anesthetized. If they do have any discomfort at all, the procedure is stopped, more anesthetic agent is applied to the vein, and then they resume pulling back the laser fiber.
After treatment and elimination of the vein, the blood that would have flowed through the closed vein simply flows through other healthy veins and back to the heart. When the endovenous laser procedure is completed, a bandage will be placed over the puncture and your leg will be wrapped to aid in the healing process. Your doctor will then ask you to wear compression stockings for a few days following the procedure and to follow other guidelines.
Patients are asked to wear their Job stocking for 24 hours a day for 3 days until they come back for a follow-up ultrasound. The ultrasound that they come for in 3 days is to make sure that there's no problems with the deep venous system. Once that ultrasound is done, then the patient can wear their stockings during the daytime hours only, from first thing in the morning until last thing in the evening for 4 weeks. And this is to aid in the healing and the recovery process. It gives good support, helps to lessen postoperative pain by supporting the vein, such as you would with a wrapping of an ACE wrap. And in 4 weeks they'll see the physician and also have another ultrasound to determine that the vein is indeed closed and that there's no blood flowing in the vein.
Walking immediately following the procedure is encouraged. Most patients are able to return to normal activity almost immediately. Patients may experience some bruising, a tight feeling, and soreness for 3 to 5 days after treatment.
I play volleyball, so after the week period of time that they suggested I take off, I started playing volleyball again like I normally would, and I felt more comfortable wearing shorts, whereas in the past I would have some difficulty doing that, and I felt more comfortable with myself being able to do that, so it was well worthwhile for me, and I would definitely recommend it for anybody who has similar symptoms or pain in their painful varicose veins. It's definitely a worthwhile thing to do.
When you have the endovenous laser procedure, the underlying problem of the reflux is fixed. However, there can be other procedures that need to be done to help alleviate the remaining veins after the reflux is done. A microphlebectomy may need to be performed just to help eradicate or take away those veins that have been there for years. They're basically like a balloon. They've been blown up and deflated so many times that it's very hard for the body to break those down and reabsorb them. Some patients require sclerotherapy as an adjunctive procedure. Sclerotherapy is when you do injections of the veins that remain. It can be done for medical or cosmetic reasons. It's basically a chemical agent, a detergent that's injected into the veins, causes the veins to become inflamed and irritated, and so that the body can break those down and get rid of those as well.
Endovenous laser therapy is a non-surgical procedure that is proven safe and effective for many people suffering from painful varicose veins. As with any medical procedure, endovenous laser therapy is not appropriate for all patients, and complications may occur. Prior to treatment, you should consult your physician regarding your specific condition. Insurance coverage for this treatment varies and may be limited. Please check with your insurance company. Vascular Solutions would like to thank Donna Ring and Dan Gabrielson for their contributions to the production of this video. Dan Gabrielson is a current employee of Vascular Solutions. For additional information, go to www.veins.nu.